How accurate are tests that diagnose colon cancer? When it comes to diagnosing colon cancer, accuracy is vital for effective treatment. There are several tests available, each with its own strengths and weaknesses. Understanding these can help you make informed decisions about your health. Colonoscopy is often considered the gold standard for diagnosing colon cancer. During this procedure, a doctor uses a flexible tube with a camera to examine the entire colon and rectum. This allows for the identification of abnormalities like polyps or tumors. Colonoscopy is unique because it can also remove polyps or take biopsies during the same visit. However, it is not infallible. Studies suggest that colonoscopy can miss about 22% of polyps, especially smaller or flat ones. For example, the miss rate for polyps smaller than 5 millimeters can be as high as 26%. The effectiveness of colonoscopy can be influenced by factors like bowel preparation quality and the experience of the doctor performing the procedure. Another common test is the fecal immunochemical test, often referred to as FIT. This non-invasive test checks for hidden blood in the stool, which could signal colon cancer or precancerous polyps. While FIT is easier to perform and does not require special preparation, it is less accurate than colonoscopy. Stool DNA tests, such as Cologuard, look for genetic changes in stool samples. These tests are more sensitive than FIT but can produce more false positives, leading to unnecessary follow-up procedures. Sigmoidoscopy is another option, examining only the lower part of the colon. It is less invasive but also less comprehensive compared to colonoscopy. Imaging tests like court colonography provide images of the colon using X-rays and computer technology. While these tests are less invasive, they may miss small polyps and also requiring good bowel preparation to be effective. It's important to note that no test is 100% accurate. Colonoscopy is the most reliable, but it can still miss lesions. FIT and stool DNA tests are less invasive but have their limitations, often requiring follow-up colonoscopy for positive results. Regular screening is crucial for early detection, which significantly improves treatment outcomes. Emerging research is also enhancing diagnostic accuracy. For instance, next-generation sequencing tests for microsatellite instability can be highly reliable, with accuracy rates above 95%. However, these tests are generally used after a cancer diagnosis to help guide treatment rather than as initial screening tools. In summary, while colonoscopy is the most accurate test for diagnosing colon cancer, it is not perfect. FIT and stool DNA tests offer less invasive options but come with their own challenges. Regular screening is essential, and consulting a healthcare professional is the best way to determine the most suitable testing approach for your individual situation.